In this video, we demonstrate the software side of the image stitching with your Drive DR. In this example, I'm going to query the database of prior patients. We see 2 patients where images have been acquired in preparation for stitching. If I was to choose the Insert Image button, it would load me into the exposure screen ready to acquire new images, or if I was to double-click it, it opens this patient into the viewer. And we have our leg length hip, our leg length knee, and our leg length ankle images. I select with the control key all 3 images. I go to the Tools menu and click on Stitch. It opens the stitching window. And if this image acquisition had been acquired with fiducials that the software recognizes, we should be able to just click the Automatic button. It stitches the images and we're basically done. To prove, we can go to the magnification mode. We can look at each overlapping segment of those stitched image. We can blend the lines between the image. We can do some cropping. And basically now we're going to save this image as a composite image. I'm going to call it a leg length hip. And now you notice back into the exam we have our 3 prior images and the composite image. I can send the composite image to PACS and it's ready for review. Now in this case, I'm going to highlight the 3 images again and go back into the stitching tool to demonstrate the manual functions. Instead of auto stitch, here we can select the middle image, and here we can pick how many pixels we want these up, down, left, right arrows to affect the image. I can really mess these images up. Go to the magnification mode, zoom in, and now I can start to tweak those images with the left, right, up, down. Again, I can pick the increment of how many pixels we want that to move with each click. And you want to go back and forth left to right to prove to yourself if you have alignment. Now we click on the bottom image to align to the middle image. And with your eyeball, you're adjusting that image to align. As you go back and forth from one side to the other, it lends itself, tells you that you might need to go up, down, left, right until you've satisfied both sides of the image. Once again, we can blend those lines, and we're going to save this image to PACS, again as a leg length hip. In this case, you'll see this patient has the original images and 2 composite images, 1 automatically stitched and 1 manually stitched. Send to PACS, close the study, and we're done.